We had rules and laws to protect animals before we had them to protect children. It's like an epidemic, an epidemic, an epidemic. Everybody keeps saying it, but nobody's doing anything about it.
Child abuse and neglect in New Mexico, unfortunately, has been that redheaded stepchild we don't talk about. It's there, it happens, and as long as it's not my kid or my grandchild, it's like, why do I need to know?
We've estimated that for the most expensive type of abuse and neglect case, those cases on average cost about $107,000 to taxpayers alone. That doesn't include the negative occurrence on kids' lives over time.
They're not going to succeed in school, they're not going to have healthy relationships, they're not going to be physically or mentally healthy. It's going to be a tremendous cost to us.
There's a significant body of research called Adverse Childhood Experience Studies, which began in San Diego at Kaiser Permanente. So he queries 17,000 men and women, and he asks them about 10 different adverse childhood experiences. Were you beaten as a child? Were you sexually abused as a child? Were you neglected as a child? Did you witness violence between your caretakers? And if you simply fit into even one of those 10 categories, you were more likely to suffer from hundreds of medical and mental health conditions, including things we would never think of being correlated with child abuse, such as cancer, heart disease, liver disease, etc. So name the social ill. You want to reduce smoking? 95% of all smokers have an ACE score of at least 1.
I oversee a program where we conduct forensic interviews of children who are alleging physical abuse, sexual abuse, or may have been witness to a violent crime. Annually, we do approximately 1,200 forensic interviews here at this site a year.
I have to go to the nurse's office every single day before
At home,
after school.
my hands would all blistered and red, and my grandma asked me
Nobody ever believed me, you know, because they were so nice and loving.
10 years ago, our average used to be 50 interviews a month. Our average now is between 85 to 95 interviews a month.
We've applied good treatment to cancer. We've applied good treatment to diabetes, to any other risk to our health. But child abuse continues to be invisible until somebody is hurt, until a child is a statistic. And that's not acceptable. It's not acceptable anymore.
This should be your #1 priority, because whatever else you care about, whatever social L you care about, you want to reduce juvenile delinquency, you want to reduce crime, you want to reduce drug usage, you want to reduce alcohol usage, you want to reduce poverty. We know from a very significant body of research that child abuse feeds into every social ill. So name the social ill you care about. If you really care about it, if you really want to get a handle on it, you have to reduce child maltreatment. We could save millions of children and literally hundreds of billions of dollars.
We also provide family advocacy, which is an incredible service, important in starting the process of healing, of hopefully getting hooked up with mental health services, maybe advocacy in the home, maybe even a food box, but that can all start here.
You would always hit
And
me.
then she told him to get what's it called?
Like on our backs,
a lighter.
and just like on our
He would wake me
arms.
up in the middle of the night and ask me to go watch
They
cartoons
said I was
with him.
lying, and I was disgusting.
It's 100% preventable. The parents in New Mexico need more support. They need education and support, and we know how to do those two things. It's just a matter of us having the will as a state to do it.
The state ends up spending far more resources, about $113 million, on child protective services, which is the negative outcomes at the back end of the system, than it does on the front end of the system.
Until we get into the prevention mode, we're going to keep doing the same old thing, the same old way, expecting a different result. We all know what that describes.